Here's a technique I've been finding helpful for many patients, especially those with pain, to find their glutes, so to speak, or to feel some engagement and stability through the back of their hips. So not just the glutes, but the hips have a series of muscles called the external rotators of the hip, a deep set of muscles. The piriformis is one that many have heard of, others such as the obturators, the gemellus muscles. Those, for the most part, create external rotation of the hip, which creates stability of the hip. And so when we're having hip pain, low back pain, sometimes even knee and foot pain, it's often something we want to work on. So for a lot of patients, though, it's painful to feel these even when we hit them with a lot of different exercises. So this technique has been helpful because it trains these muscles to do what they actually should be doing when we're weight bearing. So the idea here is we're going to start with feet straight, okay? These muscles create external rotation. So that's rotation outward. And that in this context is rotation outward of the femur. So I have my inseam here. So with feet straight, I want to feel my heel on the ground, the ball of my foot on the ground, and my big toe on the ground. Those are some constraints from the feet. With those points of contact on the ground, I then want to try and rotate my inseam forward and my inseam inward. So my inseam forward, inseam inward. That, as you can see, is not a lot of motion with my feet in this position, but what you should see in yourself, maybe see in the video and feel, is as I rotate inward, my foot rotates inward. As I rotate outward, my foot rotates outward, my arch rises a little bit, and I want to go as far as I can without the ball of the foot coming up off the ground. As we do that, the patella starts to angle over the third and fourth toes. So I'm actually starting to get some good foot and knee alignment just by doing this femur rotation or thigh rotation. Then if I stand up with a relaxed posture and kind of rotate forward and let that continue carrying through, most people, especially if they focus on it, can feel some engagement in what feels like the butt muscles back here. If I rotate my feet outward, that's often a lot harder to feel. So this constraint of feet forward gives the hip something to kind of work into, so to speak. And that can create some alignment or some feeling of the glutes. Then what the glute muscles do is when I'm on one leg, they should work to keep this alignment. So if I find this position, squeeze the glutes in the back with this slight external rotation, and then balance, you might feel a little more engagement in the hip just balancing on one leg. If you see one pocket dropping or your torso leaning, that means you're compensating in some way, so kind of reset. But we're going to come here. If you don't feel it balancing, you could just kind of do almost like a walk in place and see if you can feel the hip engaging on the ground. But regardless, the start is we have feet straight and we get some external rotation. This gets a stable hip, but actually sets up the lower extremity for some good biomechanics and often better movement. And then if you do feel this, we might pair this with some other exercises, something balancing, maybe some side steps, things like that. But the core, what we're working off of, is the hips creating this external rotation stability, but they're constrained by, I don't want to roll my ankle, so ball of foot, big toe stays on the ground. But this, if this is helpful and you can feel it, this is something you practice throughout the day. Standing at a countertop, working at a standing desk, waiting in line somewhere. Can you just kind of relax everything, look down, feet straight, ball of the foot on the ground, create some external rotation, stand all the way up, engage the hips in the back. Should be able to do that without creating lower back or kind of any other muscle engagement there. So give that a shot, see how it goes.